To that end, so quality of life is really the question for, I guess, kind of older children and maybe into adults. But what about in infants or toddlers or even those really younger children? So how do you know, or what a specific question is aspiration in an infant or a toddler kind of an indication that surgery is needed? How do you know
Yeah.
in those little babies?
Yeah, it can be really hard to sort out. It's always hard to sort out. Um, the the classic description that we'll get from parents of very young children is that the kids will be playing and will get active, and then will just, for reasons they can't discern, just stop playing and sit quietly and sometimes grab the back of their head. So even when the children are not communicative, um, in a verbal sense, they're able to communicate their symptoms by these kind of nonverbal cues sometimes. So in that situation, if the parents are giving me a description that's that clear, and there's a convincing MRI picture, then we can talk about surgery. Um, More commonly, it's frankly more difficult than that, because you have an MRI that shows a Chiari, and um, you have symptoms that you're not really sure from the Chiari or not. Maybe there's a headache because he was fussy a few times last month, but you're not really sure. And in those situations, often we'll drag our feet a little bit, and we'll stay in touch with the families and say, you know what, why don't you pay attention to what the symptoms are, and we'll talk again. And usually it'll become clear eventually, one way or the other. Like either the fussiness was some unrelated thing and got better, and the parents are happy that they didn't have surgery, or the symptoms will continue and it will just become more clear over time that it's from the Chiari, then we'll operate. So we will do a few operations on very young infants every year, but not many. It's much less common than older children. The most common time to have Chiari surgery in pediatric practices is the second decade of life. It's the teenagers for the most part. We'll do some infants, but it's unusual. And obviously the most in adult practices, it's the young adults. And those are the 2 decades of life. The 20s and the 30s are the teens and the 20s are the 2 decades of life when your tonsils are at their lowest point anatomically. So they're a little higher, and then they go down for the second and third decades, and then they go gradually up and up and up and up throughout life. So I do believe that probably correlates with the ages when we're just seeing all of our symptomatic patients as well. It just makes anatomic sense. Um, did that answer your question?
Yes, there's a little bit of a follow-up, and it's kind of asking, I guess, what are you looking for in those infants and young kids? So is it gross motor delays, aspiration, speech delays, is something specific?
Yeah, so I'm mostly trying to get a sense for if they're having the Chiari headaches. Now, if they have sleep apnea and I send them for a sleep study, then that's really helpful as well, because that's objective evidence. Where now I have a piece of paper or report from our sleep study person that says there's actual central sleep apnea. Now that really can help us with the surgical decision, because now we have the MRI, which is objective, and we have an objective sleep study. So if we're trying to discern if the headaches are from the Chiari or not, and we can't decide if surgery is a good idea, that's really helpful. I don't send everybody for a sleep study, but if there's any question that there's difficulties like that, then I do. So that's what I look for. Again, though, I'm not very aggressive about pushing parents of infants to have surgery. If we're not sure, we just wait. Mike Scott 20 years ago wrote a nice paper showing that, and he's an excellent surgeon, but even in his hands, he was showing that sometimes when you do Chiari surgery on the really young kids, like less than 5 years old, it's definitely more likely that they're going to get in more trouble later in life and have to have repeat surgery. So that's not to say you shouldn't do it early in life. We do, but it's just one more reason to just be a little bit cautious, obviously.
Yeah. I'm jumping off that. So
yeah, the question about the motor delay is a real slippery slope. I do believe most pediatric neurosurgeons would not offer Chiari surgery for motor delay. There are some that would. But that would be incredibly controversial. There's just simply no evidence that it helps. The trouble is lots of kids get better after Chiari surgery. The problem with proving that was actually helpful is that most developmental delay gets better as kids grow up anyway. So I like to think about it like a pill that I was marketing. If I have a new pill and I wanted to sell it to you to help your kids motor delay, would the government let me sell it? Would it get through the FDA on our currently available knowledge? And the answer would be obviously not. We could never sell that pill. Now, surgery is much less well regulated than drugs in this country. So I would be allowed to sell you the surgery. I couldn't sell you a pill because there's no evidence that it helps. I could sell you an operation even though there's no evidence that it helps. But I try not to do that. So very, very controversial. Some people will do it. I don't. I will do it if I can find some other reason to operate that is more proven.
Yeah. What are some of the symptoms of surgery? So if someone has not so terrible symptoms in a child, maybe elementary age, the symptoms aren't bad, they seem to come and go.
Yeah.
What's the risks of going through with surgery? Or is it possible that it's going to get better on its own? So as you say,
Yeah.
the tonsils can come back up. What's going to go on there?
Yeah, it's definitely possible to get better on its own. It's also possible to get worse, unfortunately. So we did a so-called natural history study, which is looking at kids with either no symptoms or symptoms that you described, kind of minimal symptoms that are coming and going, where parents thought, well, I'm not in a hurry. Let's just see how this goes. And when you do a study like that, we at that time had 150 kids that we followed. The Miami group had a similar study. They looked at about 100. There was a study from Italy that was relatively similar. They had 30 or 40 people. So a number of groups have done this now, and everybody's finding the same thing, which is that most of the kids that are asymptomatic or minimally symptomatic will stay about the same over many years. But some of the kids, and in our group it was about 10%, got worse and came to surgery. So they were okay-ish when we saw them, and we said, let's just kind of see how it goes for a while. 10% of that group ended up getting operated by us over time. I don't necessarily view that as a sign that like the wrong decision was made in 10% initially. I view it as a point that, well, in 10% of the cases, it just wasn't really obvious at first, and it became more obvious with time. Now, an approximately equal percentage of the group actually got better. So they had minimal symptoms and the symptoms went away. Interestingly, you can see the same exact pattern on MRI when you follow kids over time and you say, well, okay, my tonsils are 10 millimeters below the foramen magnum in 2020. What is my MRI scan going to look like in 2025? And it's the exact same story. Most of the time, your tonsils will be the same, but a certain percentage, a small percentage of people will definitely get better. We've even seen Chiaris just go away spontaneously. We've published on that. There are a number of examples of that. It's not common, but it absolutely happens. We've seen a Chiari go away and a syrinx go away in a patient, which I thought was remarkable. They somehow like just slipped through our clinic without getting surgery. I still don't really understand how that happens, because ordinarily I would recommend surgery for that person, but there they were. They had a Chiari, they had a syrinx, and they didn't have surgery. And then we saw them back, and it's like, is this even the right person? Because they don't have a Chiari or a syrinx anymore. So that happens. Other people have seen that too. But the bad news is that is balanced with another small group of people who we saw and thought, oh, this is really mild looking and you don't have any symptoms. And you see back and the Chiari is much worse, and now they have a syrinx and they didn't have one before, and now they're getting surgery. So, it's very difficult if you're a parent or an individual and you want to know what's going to happen with your child over the next 5 years. It's very difficult to counsel them in any meaningful way, because the short answer is, well, anything can happen. You could get better, you could get worse. That's not very helpful to know. But the vast majority of people stay about the same.
Okay.